Hello, welcome to the Community Systems Development Overview Foundational Training. To make the best use of this presentation, you will need the activity guide document. If you have not downloaded the document yet, please do so now. Also, please note there will be opportunities for you to stop the training and reflect on what you've learned, so you might want something to write on nearby. This Community Systems Development training is the third in a series of 7 foundational trainings that will be available to you. It will be followed by Early Childhood Data and Asset Maps, Parent and Community Engagement, Workforce, and Facilities. We're discussing Community Systems Development because the work is currently happening at the local level, and the work at the local level is interrelated to the work that will be happening at the regional level through the regional councils. We recognize that participants are coming from various backgrounds, and for some, the information shared today might be new, while for others, it may not be so new. For that reason, I want to stress that today's training will provide a broad overview of community systems development. It is meant to be foundational, serving as a baseline for learning. There will be a list of resources at the end of this training for those of you who want to explore more in-depth information. During this training, you will learn about community systems development, also known as CSD, understand the role of early childhood community collaborations, and make the connection between community systems development at the local and regional level. All right, before we get started, I want to share the agenda for the training. We've completed the welcome and introduction portion of the training. Next, we'll cover community systems development, local early childhood collaborations, regional community systems, and resources. At this time, take a moment to pause the training and reflect on the following question. Why were you drawn to the Birth to 5 work in your region? Now that you've had a moment to think about why you were drawn to the work in your region, we're going to learn more about community systems development. Here's the definition of community systems development that we work with. We define CSD as a process by which a community takes collective responsibility for its young children by building an aligned, high-quality, accessible early learning system that supports all children in becoming successful. We'll be using core components of the community systems development process to support the work at the regional level. We're now going to watch a video created by the BUILD initiative that shows us what community systems development may look like in practice. You might be familiar with it, but it's always nice to get a visual reminder. As you watch the video, think about what jumps out to you about community systems development and the approaches that are used.
What if you could get every person who supports children from birth to age 8 in one room? Every parent, educator, doctor, social worker, park district coordinator, business leader, policymaker, everyone. They'd agree every child deserves a caring and supportive community rich with opportunities for children to play, grow, and learn. And to make that happen, what if all the programs, agencies, and services for children were working together, making it so there is no wrong door for families to walk through when seeking support for their children? You'd call that wishful thinking. We call it systems building. Now, what do we mean by that? At the state and local level, a systems building approach helps partners connect and communicate in order to get the best outcomes for all children. Systems building builds on existing effective practices, from improving quality to engaging families, ensuring accountability, and promoting racial equity. And states working together so that each state doesn't have to reinvent the wheel, making it so all children can benefit from the whole system's vision. A vision where families can easily access high-quality programs and services regardless of their neighborhood. Where agencies working with children and families will have the resources to meet their needs and are staffed with people who are diverse and culturally competent. The long-term result of systems building? everyone becomes a critical part of a system that reaches each and every child. It is possible. Equitable outcomes for our youngest children need not be wishful thinking in any state or community. Together, we can get it right from the start. Let's make it happen.
So now that you've watched the video, take a moment to pause the training and think about the following questions regarding the build video. What words, phrases, or images stood out to you from the video? What are some CSD approaches shared in the video that promote effective community systems building? And how does the early childhood education and care system in your region compare to the version in the video? The state of Illinois has a vision for community systems development. They want Illinois to be a place where families can go anywhere to get access. There is no wrong door. When we say no wrong door, we mean service organizations can provide families with links to appropriate services regardless of where families enter the system of care. Families know what it takes to qualify for programs and services before they get there. Families get help figuring it all out. Our early childhood system is complex, so families need support figuring out the systems. Kids are taken care of in their communities, regardless of their age and or what their needs are. Families can count on quality care and education along their child's developmental trajectory. And families can afford what they need. You're now going to review 3 state vision success stories where you will use the Illinois vision for CSD found in the activity guide to determine which parts of Illinois' vision for community systems development is reflected or exemplified in each story. At this time, read the first state vision success story scenario and determine which Illinois vision for CSD is aligned or exemplified. For each scenario, after you pause for thought, select the answer you think best fits the scenario and then resume the training. The answer that we thought best reflects this scenario: our families can get help figuring it all out, and families have their kids taken care of in the community no matter where they, and families have their kids taken care of in the community no matter their need. In this story, the pediatrician identified some areas of developmental concern and provided contact information for an early intervention evaluation to determine if services are needed. This pediatrician helped the family figure out what the child needed and helped make the connection to the early intervention staff. The toddler was then able to receive services at their early learning program in their community. Please pause and read the second scenario to determine which Illinois vision is exemplified. The answer that we thought best fit this scenario: our families can go anywhere to get access. There's no wrong door. In this story, families can go to the library or clinic to register for early childhood programs, and they can also go to the library or school to fill out an application for public benefits, which indicates families can go to multiple places to get access to information they need for their families. Here's the final state vision success scenario. Take a moment to pause the training and read the scenario and think about the state vision that best reflects it. The answer we believe best reflects Illinois' state vision: our families can count on quality care and education at every point in their children's developmental trajectory. In this scenario, the community brings together early childhood leaders and staff to discuss their programming and alignment practices across preschool and kindergarten programs, which indicates families can count on quality care and education at every point in their child's developmental trajectory. Now that we know the state of Illinois' CSD vision, it's important to know and think about the approaches we can use to try to get there. There are some approaches that are effective and there are others that are ineffective. You're going to get an opportunity to determine the difference. At this time, refer to the activity guide and use the CSD vision for the state of Illinois to determine which community system development approach is effective or ineffective on the following slide. Here are a list of community systems development approaches. At this time, pause the training to read over each approach to determine if it is an effective or ineffective approach. Take a moment to pause the training to think about the following question. What would you say are some of the characteristics of an effective community systems development approaches? Let's review the key characteristics of an effective CSD approach. Equitable outcomes are assured for all children in the community, regardless of race, economics, health, religion, or disability. All programs and services coordinate their efforts as partners. Everyone works to enhance the quality of the available community programs and services, not a couple of organizations. Everyone works to ensure improved access to programs. And all programs and services continually align their efforts around a shared vision and set of goals. Agencies work together to ensure the vision reflects current community needs and that everyone is aligned to the same vision. We talked about CSD in general, but now let's take a look at a key player in CSD, local early childhood collaborations. Let's take a moment to think about our collaboration beliefs. Pause the training and read the following statements and decide if you strongly agree, you're neutral, disagree, or strongly agree with each statement. These statements give us an opportunity to better understand some of our own personal beliefs around collaboration. Our beliefs shape how we engage and collaborate within communities. Improving or developing community systems depends on a few things: finding the right people to participate in the effort, establishing a process for working together, and ensuring a shared vision. Collaborations are a critical part of this work. At this time, pause the recording and read the statement about early childhood collaborations. Partners recognize that working in silos, they do not reach as many families as they could, and they are not as effective separately as they could be collectively. They understand that only by coming together and working across programs and sectors are they able to solve complex systems level issues. At this time, take a moment to pause the training to reflect on the following question. What words or phrases stand out to you about the early childhood community collaborations statement? Please refer to the previous slide if needed. At this time, I'm going to ask you to pause the training and take a moment to look over the map of early childhood community collaborations in Illinois. There are currently over 50 existing early childhood collaborations, and this is a map from 2020, and it is currently being updated. Please pause the training to think about the following questions. What are some thoughts or questions that come to mind when you look at this map of the community collaborations in Illinois, and what do you notice about your region? The early childhood collaborations across Illinois that we just looked at on the previous slide all have a collaboration structure. Most collaborations have the following four elements in common: vision and mission. Each community develops mission and vision statements to reflect the aspirations and needs of the community. Diverse stakeholders. Relationships are at the core of collaborations and community systems development. Having a pool of diverse stakeholders widens perspectives and strengthens the work. Governance. Governance is the way that a collaboration is managed and the systems in place for managing their governance structure. There is no one-size-fits-all style of governance. It has to reflect the needs of the collaboration, so it can look very different from community to community. And then resources. Resources can be collaboration partners sharing time, knowledge, connections, and materials. Other types of resources include backbone organizations, public funding, foundational grants, individual donations, and in-kind donations. Let's review the role of early childhood collaborations. As previously mentioned, collaborations can look very different, and the strategies they implement to tackle complex issues can also look very different. However, they generally work to support their communities in at least one of these three ways. Continuous improvement. Collaborations work to assure programs and supports in the community are responsive to family needs, accessible, high quality, well-coordinated, and equitable. An example of continuous improvement may be a collaboration working closely with a local childcare center to assess and support their COVID-19 response. Another way collaborations work to support their communities is to improve systems functioning. Improved systems functioning is when collaborations use systems thinking and strategies to align parts of the system, build new structures and processes, and address system barriers and their root causes. An example of this might be a collaboration working with the local pediatricians in the community to embed questions about access to services when providing checkups for young children. And then there is diverse stakeholder engagement. Diverse stakeholder engagement is when a collaboration engages and convenes diverse stakeholders to co-create a shared vision and execute a cross-system assessment, planning, implementation, and action learning process. Diverse stakeholders are not only at the table, but they are also co-creators in the cross-system planning process. An example of this could be engaging parents in creating strategies to identify and address local community issues. Here's another opportunity to pause for thought. Use the activity guide to determine if the main role of the collaboration in the following three scenarios are continuous improvement, improved systems functioning, or diverse stakeholder engagement. At this time, pause the training to read scenario 1 to determine the role of the collaboration. In this scenario, the collaboration's main role is focused on engaging and convening diverse stakeholders. This is critical for the group to fully understand the issue, to develop a shared vision for what the desired outcomes will be, and to begin planning activities for implementation. Let's move on to scenario 2. Pause the recording to read the scenario to determine the collaboration's role. For this scenario, the collaboration's main role is focused on continuous improvement. While community programs and services already exist, the collaboration is focused on making sure they are equitable, accessible to all community members, and understood by those who may not speak English as their first language. How about this scenario? What role is the collaboration playing here? Pause the training and read to decide. In this scenario, the collaboration's main role is focused on improving systems functioning. While data on absences is available, they are looking at ways to improve how they store and analyze the data. Secondly, they are trying to understand the system barrier of chronic absence by understanding the root cause. Once they have that understanding, they can determine the next step in addressing the barrier, which may include additional system improvements. So we've talked about community systems development and early childhood collaborations. Now we want to explore how the Birth to 5 Action Councils fit into all of this. Each regional council currently shares 2 goals: to connect and reconnect families to services as they were used pre-pandemic, and to deliver a full regional scan of their early childhood education and care service landscape. How will the councils work to reach those goals? The councils will use regional scans to identify gaps in early childhood needs and make recommendations to expand services, amplify family voice, work closely with local collaborations to support state and community goals, communicate regularly with families, providers, teachers, communities, policymakers, and legislators, connect early childhood systems with support services such as housing and health systems, Work closely with the Birth to 5 Illinois State Team, Action Council staff, the Early Childhood Transformation Team, and other partners, and create annual reports. At this time, pause the training to reflect on the following question. Which of these actions appeals to you or intrigues you the most and why? Please refer to the previous slide if needed. Regional action councils will work with local collaborations to get a better understanding of the assets and needs in communities, build upon the relationships and partnerships that's been established by local collaborations, and leverage the expertise of collaborations to support the work at the local and regional level. Regional councils will not replace or duplicate the work of local community collaborations. Their goal is to make community work easier with the new governance and funding model for early childhood education and care statewide, one that is based on the needs of young children and their families. At this time, reflect on your role in the Regional Action Council and think about the following questions. What part of your involvement in your Regional Action Council do you most look forward to and why? And who can you reach out to for support? To recap, we learned about community systems development, CSD. We learned the role of early childhood community collaborations, and we learned the connection between community systems development at the local and regional level. Here are the resources I mentioned at the beginning of the training where you can find out more about community systems development and early childhood collaborations. The first resource is Build Initiative, along with the website, and Partner Plan Act. And then their website is listed here. Thank you for taking the time to review the Community Systems and Development Overview training. Enjoy the rest of your day.